Are you ready to learn about the inner workings of Alzheimer's disease? Before we get started, let's put our thinking caps on. Alzheimer's disease is a cognitive disorder which typically onsets during the later quadrant of life at about the age of 65. Less frequently, it can manifest at its early onset at about the age of 30 or 40 years old. However, after its initial emergence, the patient only has about 8 more years to live, and these final years are filled with a consistent cognitive decline.
The disease at its earliest is seen as memory loss, difficulty with familiar tasks, and new problems with words in terms of reading and speaking. As it progresses, new symptoms evolve, such as increased confusion, difficulty recognizing common things, and inability to form new memory, and hardship in combining muscle movements. Despite the pathogenesis or origins of the disease still being relatively uncertain, Alzheimer's is often characterized by extracellular aggregates of amyloid beta plaques and intracellular neurofibrillary tangles in the brain.
This may sound like gibberish, but let's get into it a bit more and perhaps it'll be a bit easier to understand. A common amyloid beta pathogenesis hypothesis postulates that the APP, or the amyloid precursor protein, is spliced abnormally.
In a normal or non-amyloidogenic pathway, APP is largely responsible for the release of numerous soluble ectodomains. First, the protein is cleaved by the enzyme alpha secretase, releasing C83 and secreted APP alpha. Afterwards, gamma secretase splits the rest, producing AICD fragments. Contrary to what we saw beforehand in the normal brain cell, diseased ones are broken down by beta secretase instead of alpha secretase. This means that it is split up differently and therefore causes alpha-beta plaques to build up.
The increase in amyloid beta activates numerous kinases, which in turn hyperphosphorylate the tau protein. The tau protein is associated with microtubules in the neuron, which polymerize as a result and form neurofibrillary tangles. NFTs, as they're abbreviated, often cause abnormalities in neural communications and interrupt signaling processes. This often results in apoptosis or cell death, which gives Alzheimer's its degenerative properties. Fortunately, there are many pharmaceutical options being explored, especially those that are able to inhibit the abnormal cleavage of APP. However, these drugs are not always effective, as they're often blocked by the blood-brain barrier. That's where the practice of nanotechnology comes into play. Lucky for us, those that do and do not know history are doomed to repeat it. Many are aware of the Trojan horse maneuver employed by the Greeks, and science indulges. 100 nanometer nanoparticulates are able to infiltrate the blood-brain barrier and distribute these drugs more effectively. Additionally, viruses can have similar function in transporting treatment across the barrier. With these biological covert operations, many individuals can be benefited with the potential to create a future worth remembering.